Hello everyone, welcome to our podcast, The Nurse Chat. Today we'll be talking about going from encampments to empowerment, a nursing response to Barrie homelessness crisis. My name is Crystal and I will be your community nurse for today.
And I am Elohor, Onaemor-Edor. I am your community nurse practitioner. Nice to have you here today. And today we're diving into something happening right here in our own backyard. Barrie, Ontario. Barrie is part of Simcoe County, and it was the city that sparked our community assessment.
So in September 2025, the city of Barrie declared an emergency due to the surge of homelessness in Barrie. 20 encampment sites have spread across our parks, trails, and green spaces, each one telling a story of resilience, displacement, and survival.
These aren't just tents, they're symbols of broken systems, where housing, mental health, and social services have failed to meet people's basic needs. For community nurses like us, it's a call to action, one that requires compassion, advocacy, and evidence-based leadership.
So on this episode, From Encampment to Empowerment, it's about that journey. We'll explore health and social crises surrounding homelessness in Barrie, the frameworks guiding our community assessment, and the nursing strategies driving real changes. So before we create change, we have to know who we're speaking to and why. So our intended audience includes the City of Barrie Council, Simcoe County Housing, Simcoe-Muskoka District Health Unit, and a broader community such as healthcare providers, educators, and students who all play a part in shaping how we respond to homelessness.
We chose this audience because these groups have the power to shape housing and public health policy in Barrie. They can fund, implement, and sustain coordinated interventions that don't just manage homelessness, but also work to prevent it. By engaging both policymakers and the public, we're building a bridge between decision-making and lived experiences, so solutions come from understanding, not just assumptions.
Absolutely. So encampments across Barrie have become visible signs of deeper systematic inequities in housing, mental health, and addiction care. Hundreds of residents are now living in unsafe outdoor conditions, facing cold weather, limited sanitation, and barriers to the healthcare and social support.
The numbers tell part of the story. More than 600 people in Simcoe County are currently unhoused. But behind every number is a person, a parent, a neighbor, a friend. Rising housing costs, the opioid crisis, and mental health struggles have made the situation even more urgent.
Living without shelter means living without safety. It exposes people to violence, infection, and stigma. And these aren't just individual struggles. They're public health issues that affect the entire community.
That's why this work matters. Homelessness intersects so many social determinants of health, including income, housing, education, and access to care. Addressing it means nursing has to move beyond the hospital. It has to move into policy spaces, partnerships, and prevention.
And because community health isn't about treating illness, it's all about creating the condition where everyone has a chance to live safely and with dignity. So before we dive deeper, let's take a moment to see what's really happening in the city of Barrie.
These scenes were filmed across local encampments, places where more than 600 residents are living without shelter, safety, or stability.
Each tent tells a story of strength and survival and reminds us why community health nursing and advocacy matters.
Let's take a look. Watch this.
It's encampments like this that has Barrie's mayor taking action.
We've had to today declare a state of emergency.
Alex Nuttall says it's all about reclaiming the city's streets. The declaration will allow city staff to quickly tear down encampments and hire contractors to help with the city's response, including more supports.
Social services, those are provided by Simcoe County, not by the city of Barrie, as mandated by the provincial government. And so what this allows us to do is to be in charge of that.
Nuttall says the encampments have brought a sense of lawlessness, and he attributed a host of other issues to them, like increased E. coli levels in a local waterway and what he calls rampant drug use. Earlier this year, 2 men who lived inside an encampment were killed and dismembered. The accused also once lived among them.
These are bad things, and they make people uneasy and uncomfortable. And we're going to move to restore that order.
But one advocate says those committing illegal acts are few in number, and the focus should remain on finding longer-term solutions.
We have a housing and homelessness crisis that needs to be addressed, and we're seeing more and more people and more demand on, shelter systems, which is not the final solution for people. We need more housing. We need some more supports.
Since the pandemic, cities across the country have been grappling with growing encampments. New Ontario legislation passed this summer gives municipalities and police more tools to dismantle encampments in parks and public spaces, like here in front of Barrie's courthouse.
It's a representation of our country, and at the same time, we see problems right in front of the courthouse, which is kind of ironic.
The mayor is encouraging those living in tents to seek out the new supports provided by the city, because he says no matter what, the encampments are coming down. Idil Musa, CBC News, Toronto.
To better understand the city's response, we're joined by His Worship, the Mayor of Barrie. Barrie has faced growing challenges around homelessness and encampments, including recent actions at Milligan's Pond. Today we'll discuss how the city is balancing safety, human rights, and public health, and what partnerships are helping drive solutions. Mr. Mayor, thank you for being here with us today on the Nurse Chat.
Thank you, Elohor. What we're facing in Barrie is a complex humanitarian and housing crisis. We know that enforcement alone isn't a solution. Our priority is to restore both safety and dignity for everyone in our community. This means expanding transitional and supportive housing, investing in mental health and addiction services, and strengthening key partnerships. We are collaborating with Simcoe County Housing, the Simcoe-Muskoka District Health Unit, and outreach agencies like the Busby Center and Redwood Park communities. We're also aligning our municipal strategy with the Housing First approach, moving people from encampments into stable homes with wraparound supports. At the same time, we're reviewing zoning, funding, and local bylaws to remove barriers that slow down affordable housing projects. My message to residents is simple. This is a community challenge, not an individual failure. When we work together, government, healthcare, and citizens, we can make sure everyone in Barrie has a safe place to call home.
Alrighty, so we'll be discussing key issues and contributing factors to homelessness in Barrie. So our research reveals several key issues. First, the lack of affordable and permanent housing. Barrie rental costs have increased sharply, outpacing wages and social assistance. Many residents spend more than half their income on rent, a tipping point that leads directly to housing insecurities.
Second, fragmented mental health and addiction services. Many individuals living in encampments have complex health needs, but services are disjointed. Some are turned away because they lack ID or transportation. Others face stigma, especially when struggling with substance use or trauma.
And then there's sanitation. So without access to clean water, toilets, or hygiene facility, residents face daily exposure to infection and unsafe conditions. For nurses, these environments represent preventable public health risk, from a respiratory illness to skin infection and outbreaks.
Behind these intermediate issues lie deeper contributing factors: poverty, unemployment, intergenerational trauma, and systemic inequities. Indigenous peoples, women fleeing violence, and even those who are part of the LGBT community are disproportionately affected due to historical and structural injustice.
It's important to remember, homelessness isn't a personal failure, it's a policy failure, one that reflects how society allocates care, compassion, and resources. Nurses have a moral obligation to speak up because we witness the human cost of these inequities every day. So to guide our work, we've grounded this project in theory because understanding why inequities exist helps us change how we respond.
We draw from critical social theory, which challenges systems of power and calls nurses to advocate for justice. The social determinants of health remind us that homelessness is shaped by income, housing, and access, not personal failure.
So through a trauma-informed lens, we approach every conversation with safety, trust, and respect, recognizing the resilience behind every story.
So true. Our conceptual approach brings these ideas into life. We use the participatory action framework, which engages community voices in co-creating solutions. We also engage the community empowerment model, which turns recipients into contributors. And through media-based advocacy, this podcast itself becomes a tool for awareness and change.
So together, these frameworks connect theory to humanity, transforming care into action and advocacy. Up next, we are joined by a representative from Barrie Housing and the Simcoe-Muskoka District Health Unit to talk about housing access, public health, and how collaboration can create lasting solutions for homelessness in our community. Thank you both for joining us today on the Nurse Chat.
Thank you, Elohor. From a public health perspective, homelessness in Barrie is more than a housing issue, it's a health equity issue. Our priority at the Simcoe-Muskoka District Health Unit is to reduce preventable harm by ensuring access to basic sanitation, vaccinations, harm reduction supplies, and outreach nursing care for those living in encampments, working in community outreach across Simcoe County. We see that homelessness in Barrie is deeply tied to public health concerns, especially exposure to cold, chronic illness, mental health challenges, and the spread of infections where sanitation is limited right now. Our health unit is responding through mobile outreach clinics, harm reduction services, and partnerships with the City of Barrie, Simcoe County Housing, and organizations like the Busby Center. We're focusing on on-site care, immunizations, and connections to mental health and addiction supports, meeting people where they are. Our approach is guided by trauma-informed care, meaning we focus on trust, safety, and respect before anything else. Before I go, I'd remind listeners that community health is everyone's responsibility. When we support housing, hygiene, and access to care, we're not just helping individuals, we're strengthening the health of our whole community. That's exactly what nurses from the Simcoe-Muskoka District Health Unit, or SMDHU, are doing.
How we conducted our community assessment. So before we could design any intervention, we had to understand the full picture. Who was affected, what the real challenges were, and how existing system responded. So our team began a comprehensive community health assessment focusing on the growing encampments across Barrie, Ontario.
Our goal was to capture both the health and social realities of people experiencing homelessness, not just through data, but through their voices. We used a mixed methods approach that combined numbers with narratives, blending needs assessment and capacity assessment strategies to identify both the gaps and the strengths within the community.
Quantitatively, we collected data through structured surveys, document demographics, housing history, and self-reported health using a standardized tools like PHQ-2 for depression and the GAD-2 for anxiety. We also conducted a windshield and walk-in survey, observing sanitation, accessibility, and safety conditions in each of Barrie's 20 active encampment sites.
We didn't stop there. We used Geographic Information System, GIS mapping, to visualize how encampments were clustered around service hubs like the Busby Center, Redwood Park Communities, and the Salvation Army in Barrie. That helped us see where gaps existed in outreach coverage and healthcare access, especially in colder regions and less visible park areas.
So qualitatively, we use semi-structured interviews and focus groups to hear from residents on frontline workers directly. We asked about their daily activities, safety, health concerns, and barriers to access and service. We also introduced Photo Voice, where residents captured images of their environment to tell their own stories visually. This approach turned participants into co-researchers, not just subjects, which is essential to community-based participatory research.
To ensure credibility and ethical integrity, we grounded the entire process in trauma-informed care, always prioritizing consent, confidentiality, and respect. Residents were compensated for their time, and Indigenous liaisons supported cultural safety during interviews.
So our assessment also pulled from secondary data, reports from the City of Barrie, Simcoe County, and the Simcoe-Muskoka Health Unit. So we couldn't triangulate local data with first-hand accounts. That's how we ensured our findings and are both evidence-based and people-centered.
Through this process, we didn't just gather information. We built relationships. We learned that effective assessment isn't about counting tents. It's about listening, observing, and collaborating with the community. Because in community nursing, assessment is advocacy in action.
So this brings us to our goals and objectives for this project. So every project starts with a purpose, and for us, it's simple yet powerful. Our overall goal is to advocate for equitable, sustainable, and person-centered approaches to homelessness in Barrie. We want to bridge policy, healthcare, and lived experience through community-based storytelling, using this podcast as a platform for awareness and change.
To reach that goal, we've outlined 5 key objectives that guide our work. First, awareness. We're raising public understanding of the health and social realities faced by encampment residents, the human stories behind the statistics. Secondly, we're looking at policy influence. We're engaging the municipal and regional leaders to spark conversations around housing first strategies and service integration, so policy aligns with real community needs.
Third, collaboration. So we're bringing together nursing professionals, housing providers, and outreach organizations to build stronger, united responses. Fourth, empowerment. So we want to amplify the voices of those with lived experiences because the people closest to the problem are also closest to the solution.
And finally, evaluation. We'll measure success through outcomes like the number of individuals housed, the time from outreach to placement, and housing stability at 6 and 12 months. Because impact should always be visible, measurable, and meaningful.
Absolutely. So our initiative focuses on the key groups who are essentially to meaningful change. First, the encampment residents, the individuals directly experiencing homelessness whose voices guide our direction.
And second, the municipal decision makers. That's the City of Barrie Council, the Simcoe County Housing, and the Simcoe-Muskoka District Health Unit. These are the leaders who can turn advocacy into action and policy into progress.
And third, our community service workers, organizations like the Busby Center, Redwood Park Communities, Youth Haven, and the Salvation Army in Barrie. They're the hands and hearts of this work, supporting individuals where they are every day.
By connecting these groups, policymakers, providers, and people with lived experience, we can move from crisis response to sustainable community-driven solutions.
So because real change happens when every voice is heard and every sector works together towards dignity, equity, and home for all. Up next, we will be hearing directly from a single mother experiencing homelessness in Barrie. Her story brings a human voice to the crisis and remind us what's truly at stake. Thank you for being here and sharing your experience with us.
Hi, this is Danielle. I wanted to share what this program has meant for me and my little girl. Before the outreach team found us, we were living in a tent near the waterfront. Every night I was terrified. I worried about the cold, about our safety, about how I would ever get us out of that situation. Then, the Housing First team reached out. They didn't just see a problem to solve, they saw us as people who mattered. Now we have a small, warm apartment. A nurse still checks in on us every week. My daughter is back in school, making friends, and I'm even taking classes part-time. It's so much more than just housing. It's a second chance at life. Homelessness can happen to anyone. What makes all the difference is having someone show compassion and support. This program gave us stability, dignity, and most importantly, hope. Thank you for listening.
Welcome back, everyone. Now let's go straight into our reflections and our takeaway from this podcast.
Okay, so we've heard powerful stories today, right? From policymakers and service providers to those living this reality every single day. What stands out most is how interconnected these issues are, from housing, health, safety, and dignity.
Yes. And the truth is, these aren't separate challenges. They are all linked through the social determinants of health. Without stable housing, mental health suffers. Without income, access to care becomes impossible. It's a chain reaction that nurses witness firsthand, and one that demands system-level change.
So what I take away from these conversations is resilience. Even in the hardest condition, people continue to show strength, creativity, and hope. But resilience shouldn't be the only thing that keeps people alive. We need structures that support it.
Exactly. As nurses, we can't stop at bedside care. Our role extends into advocacy and policy influence, using our voices to push for prevention, not just crisis response. Whether it's supporting Housing First models, joining outreach teams, or partnering with local organizations. Nursing leadership belongs in every space where health and equity meets.
Absolutely. So this project reminds us that health is more than just the absence of illness. It's the presence of safety, belonging, and opportunity.
And when we connect compassion with evidence and advocacy with action, we move closer to the kind of community we all deserve, one where no one is left behind.
So let's keep this conversation going in the classroom, in clinics, and at the council table. Change starts when we choose to see, listen, and be led.
Because when nursing speaks with courage, communities begin to heal. Okay, let's get into our intervention and sustainability plan.
All right, so after assessing the community, one message was clear. Temporary shelter is not enough. So we needed a model that builds sustainability, dignity, and long-term health. That's why we're proposing a Housing First model with integrated outreach.
Yes, Housing First starts with one simple truth. People need housing before they can heal. Instead of requiring sobriety or treatment first, we provide safe, permanent housing and wrap services around individual needs.
So our outreach team includes a nurse practitioner, a mental health worker, social navigator, a peer support worker, delivering care, harm reduction, and health teaching where residents live.
Grounded in trauma-informed care and critical social theory, this model empowers residents and tackles root causes like income, access, and equity.
So we'll measure success through outcomes like housing stability, outreach to place time, and quality of life, plus system-level impacts such as fewer ER visits and reduced shelter use.
Sustainability comes through partnership. So we're partnering with Simcoe County, the City of Barrie, public health, and community agencies like the Busby Center, the Redwood Park.
So we'll track progress using homeless individuals and families information system and by nameless, ensuring transparency and ongoing funding. So true sustainability. So we'll track progress using homeless individuals and family information system and by the nameless, ensuring transparency and ongoing funding. True sustainability means community integration, connecting residents to work, education, and mentorship. So call to action. So if you've been listening and wondering, what can I do? Know that action starts right here in our own backyard. There are incredible organizations in Barrie already doing the work, from outreach and advocacy to building homes and restoring dignity. You can make a difference by visiting.
Yes, you can. You can visit the Busby Center. They offer outreach, meals, and emergency shelter. You can also go to Youth Haven. They support youth who experience homelessness. And you can also check out the Redwood Park community. They create affordable and supportive housing. Barrie Homelessness and Housing Justice Network is another platform you could access. They advocate for system change. And finally, you can check out Simcoe County's homelessness system. They connect local services and resources.
So whether you donate, volunteer, share their stories, or simply learn more, every action helps. Move our community closer to equity, safety, and belonging.
Because homelessness isn't just a housing issue, it's a community issue, and together we can be a part of the solution.
You can help make a difference today, guys. Just scan the QR code on your screen to donate, volunteer, or learn more about local homelessness supports in Barrie.
That's it from us here today at the Nurse Chat. Have a good one.
Bye, guys. Thank you.